You probably heard of the Ozempic drug for weight loss that's been floating around the news and internet lately. I've been asked by several clients because their doctor recommended it to them or they heard about it from the news. So let's cover it today. It's actually a diabetes medication. And since I'm a certified diabetes educator, I'll share my expert opinion on this topic and tell you if I'd recommend it to anyone for weight loss or diabetes. And this is not medical advice, just general opinion based on my medical dietitian expertise. For medical advice specific to your condition, please see your physician. And for specific drug information about Ozempic, please speak with your pharmacist. You may have also heard of Ozempic because it's known as the Hollywood weight loss drug. It's been linked to use by the Kardashians, Elon Musk, Mindy Kaling, and Chelsea Handler, although many of them have denied using it. What is Ozempic? It's an approved diabetes medication for people with type 2 diabetes. It's not the first line of drug given for managing blood sugars, but it's a second line drug. This means if someone is diagnosed with type 2 diabetes and recommended by their doctor to take medication, they will very likely take a drug called metformin first. Then, if their blood sugar management still needs further help through medication, they will take metformin plus a second type of diabetes medication. It's important to note here that prediabetes and type 2 diabetes diagnoses can be reversed or significantly lowered without any medication, just through diet and lifestyle changes. If you get diagnosed for prediabetes or type 2 diabetes, it's very likely that your doctor will recommend lifestyle changes first before prescribing medication. Usually, this is for the first 3 months post-blood test, but depends on the blood sugar levels results and other medical conditions that you may have. In my weight loss coaching program, I have helped many clients reduce and reverse their diagnoses related to blood sugar management. If you're looking for weight loss and diabetes management coaching, apply for coaching and let's chat. Ozempic is the brand name of a generic drug that is classified as a semaglutide. Other brand names of this drug is called Wegovy or Rybelsus. Semaglutide is one type of second-line medication for type 2 diabetes management. For simplicity, I will be using the brand name Ozempic in this video. I want to emphasize that the primary use of Ozempic and semaglutide medications is for diabetes management. How does it work? Ozempic is an injectable pen medication that lowers blood sugar after eating. The mechanisms of action is by increasing insulin levels, and insulin is a hormone that is made in your pancreas that picks up the blood sugars in your blood and brings it into your cells, therefore reducing the sugars in your blood. This medication also slows down digestion and reduces appetite. The drug is self-administered by an injection with a pen each week in the abdomen, thigh, or upper arm. Regular dosage is required for this medication to be effective. What are the risks? Every medication, there are always side effects. The best is being medication-free if possible. Reviewing the Ozempic medication guide, the following are listed as warnings and precautions for use of this medication. In mice and rats, lifetime exposure to Ozempic caused thyroid tumors. It's unknown if this is the case with human exposure to Ozempic. Ozempic is not recommended for those with a history or family history of thyroid cancer or endocrine syndromes, pancreatitis or inflammation of the pancreas, eye complications related to diabetes, kidney damage, gallbladder disease, serious allergic reactions that include swelling of the face, tongue, and throat, which can affect breathing or swallowing, dizziness, fainting, severe rash, or increased heart rate, and gastrointestinal reactions, mostly nausea, vomiting, diarrhea, abdominal pain, and our constipation are the other complications that are linked to the use of Ozempic. If you're planning to be pregnant, it's also recommended to stop using Ozempic 2 months before you plan to become pregnant. It's unknown whether Ozempic will harm your unborn baby or pass it to your breast milk. Speak with your doctor if you fall into any of these categories. Is Ozempic effective? Semaglutides or Ozempic used with other diabetes medications have been found to be very beneficial for blood sugar management, specifically for fasting, so when you wake up before you eat, and also after meal blood sugar levels. It also helps lower gastric emptying, which means it slows the time that food empties from the stomach, giving you that sensation of fullness. For weight loss, it has been shown to be effective if you continue to use it. Again, I want to emphasize that the prescription medication is for blood sugar management in type 2 diabetes first, and weight loss is just an effect from the medication rather than the medication exclusive for weight loss. The amount of weight loss over time can depend on the dosage of Ozempic used. In studies, Ozempic was found to decrease weight by about 12 to 14 pounds in 40 and 30 weeks at 1 and 2 milligram doses respectively, with their trial of adults with type 2 diabetes and with a starting weight of about 210 and 220 pounds respectively. And in these trials, they were reported side effects that included nausea, diarrhea, and vomiting in up to 20% of the participants. And there are over 1,000 participants in each of these trials. So you might be asking me, would I recommend it? Obesity Canada has stated that Ozempic, or the semaglutide drug, is a game changer for options to manage obesity. However, they also say that this drug is a tool. It's haphazard to rely on weekly shots as a shortcut to manage your weight loss without addressing the root cause related to why you might be overweight, in addition to providing the education and knowledge to make informed choices about your food and health. In other words, you can't just take a pill or in this case, a shot to lose weight and eat whatever you want and not make any healthful lifestyle changes just because you got skinny. And skinny doesn't dictate physical health, energy levels, or mental health. When you make informed choices about your eating for your health and weight loss, that's when you're winning. And healthy, lasting weight loss is from lifestyle choices. Also, do you want to be taking a shot each week for the rest of your life, especially considering the potential side effects from long-term use? Considering the potential side effects like thyroid cancer and damage to major organs like your kidney or pancreas, and potential effects to your eye health, I would not recommend Ozempic for weight loss exclusively. Also, to continue the effects of any medication, there needs to be continued use. So are the potential long-term health benefits worth it? Or you can make the decision to create lifestyle change that are beneficial for your physical and mental health and still lose weight without having adverse side effects or having to jab yourself every single week. You might think that taking the drug to lose weight and then stopping will be the best idea for you. It may work, but that does require you to make changes to your eating habits and lifestyle choices. Because if you approach it this way without making any eating habit changes, it's like a crash diet. You'll just gain the weight back once you stop. Of course, if you require Ozempic for type 2 diabetes management, then that is another discussion to have. And as you might have heard, there's also a shortage of Ozempic for those who truly need it, those with type 2 diabetes. So be respectful of others who require this for their health and consider the long-term effects for yourself. I hope you found this video helpful about Ozempic. If you like this video, give me a thumbs up and be sure to subscribe to my YouTube channel to get more videos from me.